Hello, my name's Kishani Balder, and together with my sisters Ushani and Aishani, I would like to talk a little bit about my father's battle with cancer and how we got through it together as a family. My father was living in Germany when he was first diagnosed with cancer. It started with a wound on his left toe that wouldn't heal. This lasted for about a year before the doctors suspected that it might be cancer. In April 2021, my father was diagnosed with stage 3 melanoma.
At this point, my father's doctor referred us to Dr. Sharma at Asiri Surgical. He immediately recommended that we did a full body PET scan to get a clear picture of how widespread his cancer was. From this PET scan, we found out that his cancer had spread to his brain. Following the PET scan, Dr. Sharma informed us that we had two possible options. First would be the immunotherapy, and the second was pain management to keep our father as comfortable as possible. From the start, it was very important that there was 100% transparency so that my father, the patient, knew everything that was happening to him and everything that was discussed with the doctor. Being 88 years old, my father had already recovered from quite a few health complications. The first was he was diagnosed twice with pneumothorax, which was a condition in his lungs, which he fought and he recovered from. Secondly, he had a pulmonary embolism, which is also treated and we were keeping very much under control. From the start, we made everything very clear to him. All information was presented to him so that he could make his decisions.
So, as my sister mentioned, he decided to move forward with immunotherapy. After the first round, he got a chest infection. They took really good care of him. Here at Asiri Surgical, Dr. Sharma made sure that he referred my dad to a good chest physician, a good cardiologist, and all the doctors really worked together as a team to get my dad through the chest infection, and he recovered wonderfully. They also guided us on how we could take care of him at home. If we can find the resources, we can give the antibiotics at home, the saline and oxygen and so on. So we managed a chest infection and got through to the second round of immunotherapy. After the second round of immunotherapy, he got another infection, and we admitted him to Asiri Surgical. Sadly, he didn't make it through the second infection. But this is also where we truly saw the importance of palliative care in the final days of patient's life. During this terminal phase, Dr. Sharma Gunithalika made sure he did everything possible to keep our father as comfortable as possible. This included oral care, bladder and bowel care, pain management, managing secretions. We even did some light passive physiotherapy at the hospital. So he was really as comfortable as he could be up until the very last moment. And we were also guided on how to be there emotionally for our father. We were encouraged to be by his side as much as possible and talk to him, just hold his hand. So we did that. We were with him, every moment, the last few days, and he was extremely comfortable. And what we can all say with absolute certainty is that our father received compassionate care throughout and was treated with dignity. All the doctors were so respectful of our own wishes, especially Dr. Sharma, for us to discuss any thoughts or concerns that we had.
When talking about palliative care, it is very important to know the situation and to understand the situation at home, because it's quite a battle, not just for the patient, but also for his loved ones who care for him. Because we hired a professional nurse, the tipping point for that was we realized that in the midst of constantly trying to care for him, manage his medications, manage his meals, manage everything he needed, led us to finding a professional nurse. This was very important also during the night. In the case of my father, he was awake most of the night. And at the start, me and my sisters and my mom, we took shifts. So he was never alone in the night. So the nurse helped us in that sense.
I really don't have the words to describe the sense of relief I feel and my family feels just knowing that our father did not suffer in those final days. And it's really the expertise in palliative care that Dr. Sharma and his team had, and the availability of drugs like morphine that ensured that he had peaceful last few days. And palliative care like this should be available to everyone in Sri Lanka. Fortunately, we heard that there is a pilot study going on in Kandy where they are trying to make palliative care more accessible to everyone, and to try and also have care like this available at home. So yeah, just a huge thank you to the team at Asiri Surgical, and specifically Dr. Shyama Gunithalaka.